Well, actually, it's fine.
Okay.
If it does take you away.
On Streamlabs. Then click on your full video. Then go back to the Facebook portion so you can see the chat. Hello. Okay, I'll come get you. Okay. And then how do I know if somebody's chatting? Their stuff will show up in the corner, and then just hit end. And then hit end at the end.
In live video.
Okay.
And don't delete it.
Hi everyone, this is Bala Ambati. Nice to see you. I'm here to speak with you today about cataracts and cataract surgery. If you have any questions from time to time, please write a comment. On the right side of your screen, you'll see a write a comment post, and that will come up on my screen, and I'll write back to you. I appreciate your time and spending a little bit of your morning with us here at Pacific Clear Vision. I know everyone's probably at home and a bit stressed about the coronavirus epidemic, and hopefully once we get through the next couple of weeks, things will start to get better. The models are showing some pretty severe challenges in New York and other parts of the country this week and next, but hopefully things will start to turn around after that. Vision is still precious even with everything else going on, and I wanted to make myself available to you for any questions that you might have. Cataracts are the most common cause of vision loss. Cataracts are when the lens that you're born with inside the eye gets cloudy. So I have a little model here, and this is a model of the eye, and basically what I'd like to show you is that the eye is very much like a camera. The front part of the eye is where light enters, and that's called the cornea, and then behind the cornea there's a lens inside our eye, and that lens does the focusing, but it can get cloudy, and when it gets cloudy, that's called a cataract. And so a cataract is the cloudy lens inside your eye that you're born with. The cataract is your own lens in your eye that you're born with, it that gets cloudy over time, and that is the most common cause of vision loss in the world and in America. About 4 million Americans need cataract surgery every year. And what we do in cataract surgery is that we numb the eye, we give some medicine in the IV to help you relax, we put an eyelid opener to help keep the eye open. Then we go inside the eye, from the side of the eye, and once we have a small incision through the side of the eye, then we suck out the cataract with a little vacuum cleaner. And that vacuum cleaner is really small. It goes through a 2-millimeter incision, and we suck that cataract out and put a new clear plastic lens in its place. The whole thing usually takes about 15 to 20 minutes to do. You go home the same day, and then generally you'll need some drops for a few weeks. These drops have all 3 medicines that your eye needs to heal in one bottle. So it's a lot simpler than 3 separate medication bottles. A long time ago, we needed to use 3 different bottles at 3 different schedules for 3 different periods of time, and now we've been able to combine things so that we have a very simple schedule where it's just 1 bottle twice a day for a few weeks after the surgery. And that medicine has all 3 medicines your eye needs to heal in 1 bottle. A lot simpler, a lot cheaper than 3 separate copays, very straightforward recovery. Usually most people can go back to work within a couple of days after surgery. For the first 2 or 3 days, it's important not to lift anything heavy. It's important not to let water get into the eye, so when you take a shower, just wash your face separately for the first 2 or 3 days. The risks of any surgery are bleeding and infection. Those risks are very low, and we do our very best to prevent them, but they're never zero. Fortunately, even if there was infection, generally we can take care of it just with some antibiotics. The risk of bleeding, the risk of infection, each of those is less than 1 in 4,000 after cataract surgery. So it's never zero, but they are very low. Day of the surgery, you should not eat anything on the morning of the surgery. No coffee, tea, or juice. No breakfast. You can eat afterward, but not before. And you will need a driver to take you home after surgery. We do give medicine in the IV, so we don't want patients driving themselves after the surgery. So with that, are there any questions so far from the viewers? I'll pause here, and if you have any questions, please put them in your chat comments. All right, so I don't see any questions. So I'll keep going. The next thing I wanted to chat about is different lens options that everyone has at the time of cataract surgery. When we take out your cataract, we put in a new lens, and that new lens lasts forever. You'll take that new lens with you. It's made out of plastic. And there are 3 different options in general for most patients. 3 different options for what we can do for your vision. So in general, we ask everyone if they would like to do more with glasses or if they'd like to do a lot without glasses after surgery. If somebody is interested in reducing the need for glasses or not needing glasses for driving and reading, then in general the best option for them is to put in what's called a multifocal lens or a panoptics lens. And these panoptics lenses, they give a great range of vision from far away, computer and reading, so that people don't need glasses for computer, driving, or reading. Then there's an option to just get the best distance vision, and you would just need reading glasses. So that's the middle option. And then the least expensive option is to put in a basic lens, and then you would get a new prescription for bifocals or trifocals after the surgery. So those are the 3 main options. We do spend a lot of time at the clinic visit assessing each patient and their eye to see what's best for them. The testing and evaluation usually takes about an hour and a half and 2 hours. We do look for things like macular degeneration and diabetes and glaucoma, anything that might affect those lens options. And if somebody is not a candidate for an upgraded lens, we would want you to know up front. But most people are candidates, and different people have different levels of interest in the available technologies. And based on your lifestyle and what's right for you, we'll come to a decision with you as to what lens would work best for your eye. There are a lot of different lens models out there, and we try to customize the vision for each patient. Depending on the situation, we may use a laser in cataract surgery to help do the first half of the surgery. Using the laser helps with healing, and it helps reduce the swelling after surgery, and it helps correct astigmatism as well. Depending on the situation, we might need to assess the power of your eye on the cataract surgery table after the cataract is out. That's very important in patients who've had previous LASIK or radial keratotomy. And so all of those decisions are made at the clinic visit, where you and your loved one should come in, and we'll look at your eye together and come to a joint decision as to what technology is the best for your lifestyle. So it is important to spend the amount of time that's needed before the surgery to take all the measurements and measure things correctly to get the best visual result. Now, after surgery, everyone heals differently. It takes a few weeks to get to the first, to get to that best visual outcome. Usually within a couple of weeks, patients are doing pretty well, and most of the swelling is gone from the surgery. But it's certainly not drive-through surgery. It's not like you can expect to be perfect walking out of the surgery or the next day. There is some time for the swelling to go away. Also, it is common with any eye surgery to have some dryness, and that can be there for a month or two after the surgery, and you might need some artificial tears for the first couple of months. It is common with any cataract surgery for patients to develop scar tissue behind the lens implant. Again, we take out your natural lens, we put in a new lens, and you can sometimes get a little film behind that lens implant that takes some of the vision down or causes some fuzziness. And that's very easy to treat. That usually happens about 4 to 6 months after the surgery, and it's very easy to treat with a laser that removes that scar tissue. And that laser to remove scar tissue is covered by insurance. So that's not a big deal. That just takes a couple of minutes to do. It's kind of a walk-in, walk-out procedure. It's pretty straightforward. Sometimes patients may see rings around lights after surgery. That's because any new lens we put inside the eye has edge to it, and you can see the rings around lights because of the edge effect of the cataract surgery. And that usually goes away within 4 to 6 weeks. If you have rings around lights after cataract surgery, that's generally treatable with some eye drops for a few weeks, but again, those rings around lights tend to go away within 4 to 6 weeks. So that's the overview of the surgery and what to expect and the different options. Let me pause here again and see if anybody has any questions about cataracts or cataract surgery. Well, thank you all for your attention. We'll save this video and post it. If you do have any questions, please send them direct to me. You can do that through Facebook Messenger or through email. My email is bambati@gmail.com. So Ambati, BAMBATI @gmail.com. And feel free to contact me with any questions that you might have. We'll be doing another Facebook Live event on cataracts in a month. We will be doing a Facebook Live event in about 45 minutes on LASIK. And feel free to join us for that as well. And stay safe and stay sane out there. I know it's a very stressful time for everyone in the country, but hopefully things will start improving and turning around soon. Wash your hands and maintain social distancing and take care of yourselves and your families. I wish everyone well, and keep in touch. Thank you. And we will be saving this video to our Facebook page, and so anyone of your family or friends who'd like to watch this later, feel free to share it with them. Thank you very much.